Hello, hello, and welcome to Better Together, sharing our lupus stories. I'm Chanel Gabriel, and we are all the way live and talking about lupus. Now, please meet my co-host. Welcome to the virtual stage, the wonderful Dr. Michaela Baird.
Hi, Chanel. Thanks
How
for
you doing?
having me. It's good to chat and see you again. We have such an important topic tonight. We're going to be talking about health and equity. So today's title is It's What We Deserve. We're really going to be getting deep into the care we all deserve.
Yes, yes. And we want to hear from you. If you are listening, please send us a comment or a question in the chat. We'll try to get to them towards the end, but we want to make sure you are part of this community and conversation. So, health equity. Now, if you are managing a chronic illness such as lupus, you might be familiar with this phrase, health equity. But what does it mean? I'm not talking about surfing the web for a definition because sometimes those are really bland and very surface level. What does it really mean? Health equity on the ground to real people. So, Dr. Michaela, what's your thoughts on the actual definition of health equity?
I'm going to do my best to try and break it down because I think it means a lot of different things for different people. But it's really about understanding that for every individual, the factors that affect you and the health care you get are different. And that we really try and find, I like this analogy of leveling the playing field. So getting everyone equal access to what they need to get good care. I love this picture because I think it really highlights the difference between when we're talking about equality and equity. So you can see on the left, everyone's getting that same level of support. The box is the same height, but you can see, especially for the person on the right, they're not able to see. So really what we need to understand is what are the support systems that are going to get everyone to a place where they're accessing care and having the same opportunities for care. So that's, really what I want to talk about tonight. I don't know, what does it mean to you, Chanel? When you get into a doctor's office, like, how does this play out for you?
Well, I mean, first things first, that picture, it's funny enough, I use it in education. I do a lot of work around DEI in schools, and you
Mhm.
literally use that. And it's
Mhm.
so important that this is the conversation around equity, is around every system that exists in our society. Like, what does equality look like with everyone having equal access,
Yes.
and that will vary by person. But definitely as a doctor, as a patient working with doctors, I know for myself, I've had spaces where I've walked in and tried to get care and had barriers to it because of assumptions made. I'm sure that some of our guests might talk a little bit about it, talking about ER care and things of that
Mhm.
nature,
Right.
trying to access pain medication or all these different things, and not necessarily having that. And so sometimes that like mistrust that we see patients have, you know, is, from past situations where healthcare wasn't equal for us.
Yeah, and I mean, I love that you mentioned the emergency room. These are like places where, unfortunately, inequities really do play out and, unfortunately affect care. But, we want to really have our viewers take away like what we can do to keep things equitable. And, I don't know if you have thoughts or if you have a plan for yourself kind of in place when things feel a little bit out of your control or your lupus is, active. Are there plans that you have?
Well, I try to think about I have, I don't know. I feel like one of the things that's very unique for me is I've done kind of like my little hospital tour of New York City.
Mm.
Like I've been to multiple ERs and I'm like, don't go there, go there, don't go there. They're nice there, they're
Tested them
terrible.
all out.
Yeah, it's like a little mini tour, where
Okay.
you see what others are doing and knowing that like, oh, I can't going there, I'm not going to have some support, So
Right.
for me, it's like after a while, it's really taking note of the care that I'm receiving in the different places I'm going to. So I,
Mm-hmm.
even where I moved, I now live in New Jersey, and
Mm-hmm.
I was in a coffee shop and I saw EMT there. And I asked her, I was like, I didn't think about this. What hospital should I go to out here if I do have an emergency? And so that was like, she was like, what? And I was, while she was drinking her coffee. But about those things when you're in different places, like what are the supports? I also opt for urgent cares over ERs, because they do have just a vast, that's my experience, is that urgent cares might be a little bit easier to navigate. And sometimes I don't advocate for people not telling the truth, but sometimes I walk in and make my symptoms sound worse than they are so I can see a doctor immediately. Because a lot of times if they don't think that you are something severe, you will sit there all night in some spaces. And it's like, no, I'm having chest pain. And, maybe it's not bad chest pain, but I'm like, I'm having chest pain and I have a history of this thing. And they don't always ask those questions that they would need to know whether you need to be seen right away.
Yeah, it's almost like the lingo and what to say to make sure you get the access you need. And that's so interesting coming from my perspective, because I hear all the time people frustrated going, especially to emergency rooms and not feeling like, they're being heard or seen in a timely manner. So it's really interesting to hear about your plan and how you approach that. But, tonight, as we get deeper into health equity, we're going to be really bringing in a lot of exciting and interesting point of views. We're going to have an emergency medicine doctor share with us, some other patient advocates. And our goal tonight is really just to figure out how we can pull all those perspectives together and really give all of you watching some solutions to how you can get the best care, because that's really our goal here.
Yes, and we have some great guests, like you said, that are going to help us find some solutions, or at least things that can help us better navigate this. Because I know it is frustrating when you are just trying to get better and you see things that are barriers that have nothing to do with your illness that prevent you from getting access to the care, whether that be doctors, or anything of that nature, that, or the insurance system, all of those things can be barriers. So we have a power mix of advocates, parents, doctors, creators from America and abroad. We're international. Okay. That's right. Better Together is international. Let's get going. All right. So tonight we'll hear the stories of two lupus warriors, one born in America. Yes. Oh, so cute. And one born in England. And we'll hear how they demanded and got the health care they deserve. So first we'll meet independent artist and drama teacher, Chasity Hart. And right now, Chasity is currently starring in a two urban film festival special selections for 2023. Two films, Do It for Grandma and The Ride. Make sure you check these out. And she also has a new EP that you can listen to called Stages. You can check out wherever you stream your music. And looking back on Chastity's lupus diagnosis, she went from a high school track athlete to a wheelchair-bound college student. Now, thankfully, she can walk again. And we're going to hear her amazing story tonight. And Chasity says her mom, Felicia, was vital to her road to recovery. And Felicia will join Chasity to share her thoughts and advice, not just as a fabulous mother, they look like sisters, but as a healthcare professional. And Felicia's job as a healthcare executive includes hiring doctors and nurses. Then, once again, international, we have live from the UK, who stayed up late. And we have University of London alum and former BBC journalist, Jameisha Prescod. Okay, she is a digital creator, a writer, and producer. Jameisha's collabs include Meta, formerly known as Facebook, Huffington Post, and Adidas. She is a fellow of the Royal Society of Arts. That's what FRSA means, right? After her name. And it's one of the oldest and most respected societies in the world. Jameisha is the founder of You Look Okay to Me. Her metaverse platform shares stories and raises awareness for those living with a chronic illness. Tonight, Jameisha will share what lupus is like living in another country. We like to talk about America on this show. We're going to talk about what it looks like across the pond. Okay. And last but not least, I told you, we got great people in here. Our expert is a very cool hyphenate, medical doctor and a filmmaker, Dr. Ade Osinubi. Dr. Ade is a graduate from the prestigious Brown University Medical School. You better go, girl. And there's that viral pic. And she's also a Forbes magazine under 30 scholar. Okay. When she's not saving lives as an emergency medicine physician, she's documenting stories in spaces such as PBS, Teen Vogue, Forbes, Essence, the Washington Post, Glamour magazine. Her award-winning documentary, Black Motherhood Through the Lens, also addresses health equity, and it'll be premiering next year. So excited and can't wait to see this. So right now, we got some great guests. So let's get started. You ready, Dr. Mika?
Ready, let's go.
All right, so we got our first guest. Now we're gonna meet independent artist and drama teacher, Chasity Hart. Her lupus illness led to hip replacement surgery and paralysis. But she says positivity, therapy, and a pushy mom helped save her. Dr. Mika, you wanna introduce our guest?
Yeah, so I guess we have Chasity coming in, and
welcome to the virtual stage.
Hi, Chasity. So tell us a little bit about your story in your words. You know, it's always better to hear from you guys.
I mean, so yeah, like they said, I was in high school. Specifically the summer before I was diagnosed, I did not train, and so I assumed that I was just out of shape when I was running. But pretty much my knees and my ankles were swelling like the size of almost basketballs. It was like every day after practice, I was having extreme swelling. Mm-hmm. And I actually was about to get knee surgery, although they didn't see anything on the x-ray. And my hands swelled, and my pediatrician stopped the surgery from going and said, we need to do more tests because this wouldn't be impacted by your running. And then after more and more tests, they found out I had lupus. And from there, it has been a journey.
Yeah. I mean, you kind of sum up that, you know, diagnosis stage quickly, but I know that can take a long time. You're going back for imaging, your knee was being worked up. So what was the most frustrating part of that time period?
I mean, I was in high school, so I just couldn't do normal things anymore. Like I could barely walk. It's like everything was painful. I was just in a lot of pain all the time. And they did not understand why. And then I can remember seeing this girl on like America's Next Top Model, and I remember she had lupus, and that was like the first time I ever heard the name lupus. And I remember her hair fell out, so I was like, well, Lord, as long as I ain't got that.
Mercedes, that was Mercedes.
Mercedes, that was her name. And then sure enough, I was like, okay, juvenile arthritis, because we were doing our own Google research. But I was like, you may have this, you may have that. And
right.
Lo and behold, but I was happy when I don't know if I want to say happy, but I was relieved when I was diagnosed, because it was just like, okay, now I can tackle it. I didn't feel so out of control because I was just going from doctor to doctor to doctor. And I wasn't on any medicine. I was just in pain because they couldn't figure out what was going on.
Yeah. Thank you.
And definitely, I know that like that process of diagnosis, yeah, the same thing. I very much, when I got diagnosed, was like, I know what's wrong with me now, right? And but also knowing that the issue sometimes around like going from doctor to doctor, or doctors not necessarily paying attention to our symptoms and thinking it's all there. Sometimes it's a bit of confusion, because lupus can be confusing, but sometimes they don't always listen to women, Black women, things of that nature when we talk about specifically what's going on. But so you say your mom was vital in your recovery. And so we're going to bring her into the conversation. Welcome, Chastity's mom, Felicia.
Hello, ladies.
So good. Yeah, so welcome to the stage. So Chastity's mom, Felicia, is also the chief operating officer for a Florida-based healthcare organization. We're going to get to that in a bit. But Felicia, what was it like to hear Chasity relive those high school moments? Like, what do you think?
You know, I kind of teared up a little bit. I'm like, oh man, I didn't bring tissue in here. I wasn't expecting to cry, but it, you know, that it was difficult. You know, as a mom, I think, you know, we're nurturing you. We take care of our babies, and you know, she's my baby. And at 16, she was still my baby. And so when you see your child suffering as a mother, you know, we have our remedies. We know what to do. We get right on it. With this, you know, and lupus is such a you know, mysterious type of condition where you don't really look like what you're going through, is what I say, right? That's kind of always the thing. It's very rare that Chasity, you can look at her and you would know just how sick she was. So just going through that was very difficult for our family. But of course, being able to get her the help she needed and finally understanding and knowing what that was, it was, it was a hit for us. But like she said, it was also a bit of a relief because now we could at least know we have a name for what's happening, and okay, what does that mean for us, and what do we need to do to help her get better?
Felicia, from what we understand, of course, there were like multiple opinions you were getting, and you were really pivotal in her going ahead and getting, second opinion. So what did that look like?
I think anytime you're going through something health wise, it's very important for you to listen to your body and don't um, suppress your instincts and how you feel. Sometimes when you're in situations where you're talking to doctors who have a lot more training and education around medicine and science than you can be a bit intimidated about asking those questions. But for me, and and I as a mother, I think a big part of it was just you fighting for your child. So I'm going to ask those hard questions. I did my own research. I tried to go prepared. And so that just kind of looked like making sure that we want to get multiple advice from multiple professionals to make sure that we are getting the best care and treatment for her. And even if that is scary and difficult, we're going to ask those hard questions because I wanted her to have the best care possible.
Yeah, you're an amazing advocate, and it sounds like you and Chanel have been talking with the preparation piece. But I wanted to pull back and talk about, your hat as a healthcare executive. So, when you think about giving advice to other people who are really trying to figure out how they get another opinion or their symptoms reevaluated, what thoughts would you offer them?
Again, the thoughts I would offer them is to really be bold, even when it does not feel comfortable. I think that's the biggest part. They're going to be, and all providers are not created equal, right? Some are very welcoming to questions. Some
Sure.
are not. And I definitely had my days with some of the specialists, which we're great now, but in the beginning, they did not like my probing and they did not like the fact that I asked those questions, or I may have even come in with, hey, I heard about this new medication that's out, and I heard that this is a better treatment option for women of color, or just different things that I think sometimes can be offensive to some providers, not all. And so I think it's important to empower yourself with that knowledge, and also be prepared to talk about what it is that you want to cover for yourself. Don't be a participant in your care and not just be driven by what someone is saying to you. A lot of times we go to the doctor, we just sit there and we're receiving information and there's no dialogue. We're not saying anything. It's just, okay, the doctor said this, the doctor said that, but you should be a participant in your healthcare and be able to ask those questions so that you can get out of it what you need, because only you can advocate for yourself and know what you're really going through on a day-to-day basis.
I couldn't have said it better.
No, thank you. Thank you. And we also have like just really quickly, I feel like it's important to also ask, Chastity, you mentioned, you started college and then ended up paralyzed. And that's a traumatic thing to have to go through. Well, can you speak really quickly about the moment you thought you might not walk again, and just talk about what got you back walking?
Ironically, I had this crazy optimism, and I think maybe that was my youth naivete that I did not think I was going to walk again. I actually laughed when they said I wouldn't walk again, and that may have been, just God in me. So I never accepted the reality that was my reality, because I just felt like that's not what God had told me. And I'm like, girl, I'm putting the heels back. Oh, I know what y'all talking about. And so for me, I really maintained a crazy level of optimism that I just didn't believe it. And so I think the fact that I didn't believe it, it was like I could move a finger and then I could move a toe. And then I felt like half of my leg, and then I felt a knee. And so it's like when it was happening for me, I was like, I told y'all, because they were telling me that. And to me, that was just like a foreign language. So I just really did not receive that because it just seemed so far from anything I envisioned for myself. So my doctor did say that, my positive attitude, he thinks also helped. because I really could not move. Like, and even when I started getting my feeling back, they would say, move a pinky. I was moving a middle finger, like the nerves was not connecting. But I just felt like it was just like a time thing. I didn't think it was a forever thing for me. It was, and so it was scary, but I definitely was, I just didn't think it was permanent, if that makes sense.
I love your perspective and your approach, Chastity. You know, of course, your mom's a huge supporter for you, but who else is in your support system, especially during that tough time period?
Oh, I have an amazing family. My dad, my sister, my brother. I'm the oldest. And so I did for a long time feel like I wasn't a good older sister because I was always sick. And so it really bothered me that I like couldn't drive around or couldn't like do things that other older sisters did with their siblings. And so I was so happy when I was healthy enough to like feel like I was really being the big sister. Because for a long time I just felt like I'm always sick, like everybody always have to take care of me. And they were very much there for me and supportive of me. And so yes, I have an amazing family. My aunts, my grandma. I was showered with a lot of love. My church family. And so yes, I was always surrounded by love and close friends. Like my friends would be in the hospital with me. My college roommates, we're still best friends now. Like they saw me go from being a normal college student to not walking. And it was just like with my paralyzed situation, I'm gonna talk as quickly as possible. I felt the numbing process. So I felt my body go numb. I just didn't realize it. So my legs were just getting heavier and heavier. And so I was just kind of moving through life. I didn't really realize that I was actually going paralyzed until it was like, I'm paralyzed type of thing. And so that was another thing, listen to your body. Now, if I have any numbness, I pay really close attention. But at that time, I definitely was oblivious to what was happening. I was clueless. I was still going to class, but I was walking like this slow, like it was like picking up 100-pound weights to lift my feet, not realizing that I'm losing feeling in my body.
And so thank you so much for bringing that in, like this idea of what it took to also listen to your body and learn that. But also, that's awesome that you have so many people that are in your corner. And while we of course want doctors to be in our corner, sometimes it is great to have the family that's also that fortress, fighting for you and fighting with you alongside you. But we're gonna keep talking. We're gonna keep talking. But I'm gonna bring in our next guest. Our next guest won 10,000 pounds. Yes, not dollars, pounds for her creative solution to improving health inequities. Yes, pounds, not dollars, because our guest lives in London, England. Welcome, Jameisha Prescod, all the way from the UK, 5 hours ahead. It's almost midnight in London and still stayed up to be with us. Welcome to the virtual stage, Jameisha.
Hi everyone. I didn't realize you had that picture, so that one surprised me. I was like, who won the money? Like
That was you, my dear. So now you're gonna have to tell us all about You Look Okay to Me. That's your global platform in a minute. We're gonna talk about it in a minute. But first, as always, we'd love to hear your lupus story.
oh well, honestly, I really reckoned with Chastity when you mentioned America's Next Top Model, because that was also the first time I actually heard the word lupus, and I was like, "What the hell is that?" I'm so glad I don't have that. Go figure. But I started getting sick when I was in high school. High school's a little different, so we end high school at 16. So I was running track, but then I was getting all this pain in my joints all of a sudden. But I ignored it, and I thought maybe it was my own fault. Like, stop eating candy and just eat better, exercise more, take it into my own hands. And then when I got to uni, it just got worse and worse and worse. And I had like a massive flare up. And it took me about 18 months. I was going to doctors trying to figure it out. They said, oh, it's a vitamin D deficiency, it's anemia, it's this, it's that, you should have some vitamins. And then eventually kind of one doctor started to take me seriously and she mentioned lupus. But when I'd come back, she was like, I saw a different doctor and they were like, oh, it's a mental illness. It's all in your head. You need to take antidepressants, see a psychotherapist, and then you'll be better. And I'm like, I don't know, it just didn't feel right to me. So luckily, with a long waiting time, which is kind of the case in the UK over here, I was able to see like a proper lupus team. And eventually he was like, it's very obviously lupus, of course. And ever since then, I've been able to kind of actually get the care that is tailored to lupus specifically. So that's it in a nutshell.
That's amazing. I mean, I'm glad that you were able to advocate and eventually really see the doctor who is going to help you. I mean, it doesn't stop there. And have there been other moments where, you know, you've really felt like not heard or, you know, judged?
Yeah, so I've got like more than lupus. I have a couple other conditions, and it's like every time there's something, you'd think that they'd be like, "Oh, we got it wrong for lupus this time." Maybe if she says something's wrong with her, we'll actually believe her. But yet, still, every time there's been some kind of condition, I have like hip problems. I have hip arthritis, and same thing. They said, "Oh, it's not a hip problem. We think it's your back or whatever." But I would even say maybe for lupus, retrospectively, I think I get angry when I realize actually I wasn't taken seriously because I've kind of internalized it and I often don't make a big deal about things going on. So I'm in pain all the time and I've kind of just accepted that's kind of the fact of life. So I just move through life. But I've got a new lupus doctor now and she was like, yeah, I'm going to try and change your medication. You shouldn't really be feeling pain like that. And it made me angry for past me because I was like, I thought that was what this was. I thought, you know, I'll take my medication so that maybe my lupus doesn't progress, but I'm going to still have to just deal with what I'm going through. And she was like, no, I want to make you have as close of life to a 27-year-old as you can. I don't think you should be dealing with some of the things you're dealing with. So sometimes it's more like I have to look back and realize how much I've kind of been dismissed because I didn't even realize at the time.
Is there advice you'd give kind of looking back? Because that's kind of our theme of how we can, you know, fix these issues. What do you think could have been done differently? It's hard.
I think for me, it's kind of, I think similar to what Felicia was saying earlier. It's like being an active participant. I kind of always thought I was, but I think there was more. I think sometimes I get tired and I'm like, "Ugh, I just don't want to deal with this." So maybe it's being like active, and part of being active is actually turning to other people and saying, I don't have the capacity. I have lupus. I'm really tired, but I'm gonna need you to kind of really help me get this help. And I wasn't doing that. I don't really ask for help very much.
Right.
And I think maybe things could have gone differently had I maybe turned to someone and said, actually, I'm really struggling and I need help to make these people actually see what's going on is really serious. I do that now, but it was hard to do it back then.
Thanks.
I mean, thank you. And no, definitely, I resound with that. I have a whole poem about about my diagnosis, which is called Vanity, and the idea that sometimes we don't think about taking care of what's going on underneath the surface. And so thank you for bringing that back to light, and this idea of like what it means to like really advocate for us when we're not feeling well. But let's talk about equity in England, because here in the US, a lot of times we like to just say, oh, it's terrible here, and why can't we just be like our brothers and sisters across the globe and have this wonderful free healthcare system, universal healthcare? And we showed a picture a little bit earlier illustrating equity versus equality. Now, I know that out there, everyone has healthcare, right? It's provided. Is it the quality equal? Is the quality equal? Why or why not?
I would say overall, no. So, like, technically, in theory, we all have access to the National Health Service. So, we have public healthcare. However, the UK is steeped in classism. It always has been for a very long time. And so, the quality of your healthcare will vary depending on the area that you're from, despite the fact that it's still the NHS. So, if you're from like a more of a wealthier area, you will most likely have a better doctor and shorter waiting times than if you're from a lower income area. And usually, in cities, the lower income areas tend to be mostly made up of people of color, Black, Asian people. So in theory, it's supposed to be that way. And I always have to caveat and say I'm very grateful to actually, be able to go to the hospital and not have to think about the ambulance cost or sitting in I'm very grateful for that. So I want to make that clear. But at the same time, there are gaps in the treatment in how some people are treated here and how others. And we see that very blatantly, whether it's class, but also your skin color. And also if English is not your first language, all of those things have very evidently impacted the way people have been treated. And we saw that especially when George Floyd was killed. And then we had Black Lives Matter protests here as well. And then we started talking about healthcare. And that's when all those conversations started coming out. And that's when we realized, for example, like Black mothers are 5 times more likely to die in the UK as well. Those stats came out in the US, but they come out here. So we started realizing, well, technically we all have access to it, but the quality of care is not equal.
Thanks, Jameisha. I don't know as much about your healthcare system. So say you were seeing someone locally, do you have access to see someone in a different area, or can you seek out, for example, a rheumatologist in a different part?
Yeah, so it's tricky. So your GP will most likely, like your regular GP, needs to be in your area. So you can change, but most likely it would need to be in your same borough in London or whatever part of the UK you're from. If you want to be seen by a rheumatologist, you need to ask your GP to send you there. You can't always choose. And also that hospital will need to be nearish. Unless you're in a severe situation, then they might send you somewhere really, really far. So like my hospital for lupus is not near me. So my local hospital does have a rheumatology wing. They're just not as good. So I have to get the train to see my rheumatologist. So we can sometimes go out of area for better care, but it's very specific, and the wait times to even figure out if you can have that care can be very long. So I think for me to get to see my clinic, it was a 6-month waiting period from when they sent the request. And I was still getting symptoms, didn't know, like I didn't have an official diagnosis, but I was waiting just for them to accept the letter. So, yeah.
Wow.
That whole process. And I think it's interesting to see that we're having the same conversations across the waters, and that there's still this need, while we definitely, want all of us to think that this is not an issue, a global issue, to see that it still is, because that same thing applies in a lot of communities of color, is that it's really, really hard to get a doctor's appointment, especially at the last minute, if there is an emergency. But thank you for sharing. And I'm just want to go, your platform is called You Look Okay to Me. That is a great name. So now how and why did you come up with that idea?
So I have like 2 explanations for it. I have like the official one that I tell most people, which is like, it's something that people with lupus or whatever kind of chronic invisible condition hear a lot, oftentimes they can't see. I also do say, is like, I think you can see if you're looking hard enough. If you look harder at us, you actually can see that we are dealing with something. But for those that are not looking hard, they tend to be like, oh, you look okay to me. So that's the kind of gist of it. However, I had a competition at uni that was giving the original funding for You Look Okay to Me, and I needed a name. And I was just like, oh, okay, I'll write that down. I'll change it later. And then when I pitched, the guy was like, wonderful name. Well, that's amazing. And then I was like, yeah, I totally took ages thinking about that. And then it stuck.
And like, I know that this is not just local to London. Like, where are some people that are a part of your platform? Where are they from?
They're from all over the world, which surprises me. Funnily enough, the largest split of my audience are actually from the US. So, maybe like 55% of people are from the US, and then most are from the UK, and then some Australia and Europe. I think especially in the early days when I was talking about lupus, I think it resonated in the US a bit more. I think it was more known in the US than it was the UK.
And on your platform, what do you hear from people about like the difficulty in diagnosis and quality of care? Are you hearing some of these same themes, or is anything new?
So many people say the same thing. It's like a broken record. Like everyone comes and be like, they said it was a mental health issue. They said it was vitamins. They said it was my period. I said it was like, it's amazing how similar the story is. So you'd think that maybe people would go, maybe I should walk back on saying those things, but no, it's just the same thing. And it's usually from women not being believed.
Jameisha, hearing that story and that narrative over and over again, like what do you communicate from your platform? When you think about how can we fight that and build better health equity?
I think it's a mixture. So sometimes I try to give actionable, helpful tools if I can, or open up a conversation so that others can talk to each other and like share those tools. Like some people did me. There's like mini things that you can be like, ask for this specific blood test, which you wouldn't know about. Because side note, in the UK, they'll say your bloods are fine, but they've tested like 5. And they've not actually gone and tested the lupus antibodies, right? So I'll give them like specific things, but then also be like, let's look at like maybe some of the history as to why this is like that, and like try to use that to deconstruct it. Because the reason why I think we face some similar issues is because it's still Western countries, and Western medicine is steeped in a lot of colonialism. Like the roots are very racist. Yeah. So I think if we can draw attention to some of that, then hopefully maybe in the new gen of doctors, we can kind of be like, hey, this is the root of it. Let's let's get rid of those dirty roots and like build a new foundation, and hopefully that can change things systemically across countries as well.
Yeah, you're so right. It's really understanding the system and how it's built into it. Yeah.
Yeah. And I think that that's so important. The other side of the conversation is how do we, as lupus advocates, help advocate for each other and share these tools and share these tips and things like that will help you, because you brought something else to light, not just race, but womanhood. Yes, everything gets blamed on our cycle. everything. It's like you're hormonal, when it's actually real issues. And so, speaking of like even more depth about doctors, we're going to bring our expert guest in the building. Dr. Ade said she knew she wanted to be a doctor since she was a young girl. And we're going to welcome her and bring her to this space. Oh, look at the baby doctor. I love it. And Dr. Ade, we're going to welcome you to the virtual stage. Dr. Ade Osinubi. Thank you so much. Dr. Ade is an emergency medicine resident physician. That means she's an ER doctor, like George Clooney. No, but for real, Dr. Ade practices at Penn Medicine in Philadelphia. So hello, we are so excited to have you here, Dr. Ade. And one of your first experiences with health equity happened on your high school trip to Ethiopia. Please tell us about this trip.
Yes, thank you so much for having me. Really excited to be here. Thank you so much, Chasity and Jameisha, for sharing your stories. Very powerful. So for me, I've been interested in medicine for a long period of time. It was only until high school when I got interested in women's health, particularly surrounding the issue of obstetric fistula. So for those of you who may not be aware, it's a birth injury caused by prolonged labor. It actually happens in the United States, but it's typically repaired right after. But for those in low-resource countries, women may be left with these fistulas, causing them to leave their urine and waste, and then causing them to be socially stigmatized in their communities. So in high school, I created a nonprofit organization called the Iris Fistula Project to support the rehabilitation of women with obstetric fistula. Through that nonprofit organization, a friend and I created a documentary about obstetric fistula to raise awareness and also to raise money for the women affected by this condition in northern Ethiopia. Through that experience, I really learned about my passion for health equity as well as advocacy through media, which has informed my current work with writing and documentary film. And having that experience internationally was great, but it also reinforced this idea that, we have problems on the ground in the United States, as Felicia mentioned, and the Black maternal mortality crisis. Also disparities impacting lupus patients. So that has been my intro into health equity, and I haven't looked back.
Dr. Ade, you're doing so much. Thank you for sharing. I'm so interested in hearing more about some other people who may have influenced you becoming a doctor. I think your mom might be one of them.
Yeah, so my mom is, right there on the right. She's a occupational and environmental health specialist. She actually started with anesthesia. And she has been my number one mentor. Seeing her working hard, trailblazing from a young age really inspired me to be in a physician and has been an incredible privilege. So now she does more of functional medicine. So that's really root cause and preventative medicine, which is something I'm hoping to get into in the future and can really benefit those with chronic and autoimmune diseases.
Well, we want to, take all your knowledge because you work a lot in the emergency room. I know, long hours there. And we've been talking about health equity today. So, I was in med school, I won't say how long ago, but we didn't really have conversations about this. And now I teach in the med school and we do, but I kind of want to hear how the conversations changed for you who's recently graduated. Like, what are you talking about from the med student perspective or as a resident when it comes to health equity?
Yeah, that's such a great point. So for me, I went to Brown University for both undergrad and medical school. And for those of you who don't know, Brown is very socially conscious. But we are oftentimes talking about these social issues of equity. So I was really blessed to be in that type of an environment. In medical school, those were pretty common conversations that we had. There was actually a class that I took by a really great professor called Dr. Lundy Braun, who specializes in this type of work. And so we learned all about various tools that were used in medicine, such as race corrective factors to estimate glomerular filtration rate. So that's to measure kidney function. And then also race-based correction factors to determine if women can have C-sections after a vaginal delivery. And so learning about the historical context behind these health inequities was really enlightening, because it, provides context in how to address these inequities here today. So I think there has been a lot of work done to promote health equity in medical schools across the country. There's still a lot of work to be done. But I'm also grateful to be in a residency program, in the city of Philadelphia that is committed to these issues as well.
Yeah, thank you so much for sharing all the cool work you're doing. I mean, it's really relevant when we think about, you mentioned GFR, which is a kidney function measure for people who are dealing with lupus, because for a while we have, and some hospitals still have, these different cutoffs for what we measure as poor kidney function, and it's race-based. So you can imagine how that can create a lot of inequities with how we treat, when we decide to treat. So I thank you for bringing that up. So there's just so many different things that can impact people from when they first enter the healthcare system. And you're often that entry point working in the emergency room. So tell us more about what you see there.
So I actually came off of an overnight shift this morning. So I was actually thinking about doing obstetrics and gynecology because I'm very much into women's health. But I transitioned to emergency medicine because women oftentimes use the emergency department. And there's a huge need for those who are passionate about women's health in that space. So we see a multitude of different things, anywhere from a code, an emergency, someone's heart stops, to, primary care, because unfortunately people can't access their primary care providers due to the state of the healthcare system today. So I have had a couple of lupus patients that I've already taken care of, whether it be a flare, pain, and then also like medication side effects as well. And so it's been really interesting, like learning and working with patients with chronic autoimmune disorders, because although we learn about it in medical school, we don't necessarily get the firsthand interactions as much unless you're doing a rotation with rheumatology, which is physicians who focus on these types of disorders.
So, we're talking tonight about health equity and social determinants of health. Tell our viewers how you see those play out in the emergency room.
Yes, so that is a great and loaded question. So for me, as a Black woman physician, I made it a point to do residency in a place where there would be patients who looked like me, to kind of serve as that voice, right? And so unfortunately, I have experienced and witnessed, unfair treatment sometimes, pain not necessarily being taken seriously, symptoms may not being taken seriously. And it has been, my duty to really address those head on and focus on areas that might be overlooked in patients of color.
Amazing. Did you want to ask Dr. Ade anything, Chanel?
I was like, you're just going. I'm listening, just because the ER was my best friend for a number of years, and definitely knowing that you go into spaces and we'll say I'm in severe pain, and people are like, I'll give you a 200 milligram of Tylenol, or being told like, oh, you're just here asking for pain meds. And so, just curious, like, what are the ways to handle when those things happen in a space?
Yes, that's a great question. I think self-advocacy is very important. But again, everyone has different personality types. Everyone has different backgrounds that influence their ability to advocate for themselves, right? There's medical literacy, so knowing the right language to use, which Chanel, you mentioned earlier. And so I think that, I've had patients, I usually make it a conversation. Hey, do we want to start with Tylenol or ibuprofen? And then if that doesn't work, do we want to go to something stronger? Some patients may say, hey, I want a stronger pain medication, or I'm actually okay with starting from that. So I really try to make it a conversation and, make it open dialogue, like, hey, I know you're not pain seeking in this situation. You're in a lot of pain. You have this condition, and, you're entitled to have that pain. And so I think having that conversation, and, if you have been in the emergency department before, knowing what pain regimen works for you, and being comfortable saying like, in this scenario with this flare, this medication works for me, this doesn't work for me. And so I know not to order the medication that doesn't work for you, you know? So that's kind of how I've approached it as a resident. Again, I've only been at this for a little bit over a year, so still a very steep learning curve. But I really just tried to make it a dialogue.
And are there any other questions? I know we have other guests here. I'm just curious if there's any questions or any reflections on what was just said.
I'm just very grateful for doctors like you to exist. I think it's really encouraging whenever I see doctors like you talking about this type of things, and I hear it on like TikTok or other forms of social media, but I'm just very grateful. It gives a bit of hope.
And I saw Chastity was going to say something. Go ahead, Chastity.
That's what I was going to say. I was like, you go, girl. I'm over here keeping all my stuff together because I'm extra. I'm like, yes. I'm so glad that they get to experience you because I've never even seen a woman of color in the ER and I have been, honey. And so that's just so beautiful. And to just know that you're there representing and like actually in the space that we need, it's just, yes. Shout out to you.
Thank you.
You're that girl, that doctor. You're her. Yes.
I just had actually a question for you all who have frequently, been in the emergency department in these flares. What are some things that actually worked for you in those scenarios that maybe I can take away and spread to, those who I work with?
I'd like to jump in. I think you were kind of head on when you talked about knowing what your past experience has been and kind of just getting to that quickly. Like I remember a situation with Chastity where she was having a flare after we had kind of come out of the paralysis, and she started having some of the symptoms again. And so we kind of knew what needed to happen and what needed to happen pretty quickly. And so depending on what you say or don't say, kind of moves you through the system. But I could see those providers who appreciated us being able to say, okay, listen, she has lupus and also avascular necrosis. She has 2 hip replacements, blah, blah, this, that. Her doctor is willing to speak to you. Her rheumatologist will speak to you via cell phone. Are you interested? We have that. And we normally on this much medication, a particular medication that she had to always get on that would kind of get her down because, with certain things, you have to kind of move fast or it can progress really quickly. And so I think having the patients be able to come with that information and being a provider that is receptive to that, because I know sometimes, especially if it's someone that has been there frequently, right? There could be a little bit of doubt about, okay, is this someone that's just abusing the healthcare system and don't understand how to use ER, or is this a true emergency? And so I think just having that open-mindedness to be able to put what they're saying, of course, looking at that medical record and being able to understand, okay, this is an informed patient and I need to take time to hear what they're saying.
And you brought and you brought up something, and I love maybe Dr. Michaela or Dr. Day could explain. I mean, I think we use ER, but what's the difference between emergency care, urgent care, and a healthcare provider? Like, well, when should you go to each? I think that's also something that a lot of times we don't know what we have access to either.
Right. So, well, with the primary, I'm sorry.
No.
Okay, she don't want me.
Oh wait, I forgot. You definitely work in. This is your work too, Felicia.
My daughter's like, shut up, mom.
She said,
No, I apologize.
Felicia, you probably say it better.
Go ahead.
I'm so sorry.
No, you got it. Don't apologize. Go ahead, Felicia. You was ready to.
Okay, well, I mean, we know primary care, that is kind of like your routine primary care, we call it medical home, right? This is where you're going for all your routine care, your routine blood work, depending on what your chronic conditions may be. That might be an every 30 day, once a month. It might be a 90-day visit that you're having, and this is the provider that's kind of the gatekeeper of all the other providers that you may have to see. They're going to be in collaboration with those specialists, whether that be your rheumatologist, your cardiologist, endocrinologist. It just depends on your situation. I see them, or us, because I do work with primary care providers, as the gatekeeper for all things related to that. Emergency care and urgent care, I feel urgent care is just like a step down from emergency. And it's depending on your insurance, which you have to consider. A lot of times they encourage you to go to the urgent care, and your copay is probably a little bit less if you frequent urgent care. And a lot of times they can do a lot of what the emergency room can do, but they don't have trauma units and things like that. And so if you are not needing to see your primary care, I would say urgent care would be your next step, and then emergency care would be what you need if you're in a more of a trauma situation. Sorry, doctor.
There's no sorry. You did such a good job with that. I'm so glad you were here to be able to answer that. Jameisha gave you a round of applause.
Yeah, girl.
So, thank you, Felicia. It was well said. Dr. Ade, if we could just, kind of tie it up, and ask you, what should one do if they're in the ER and they feel like they are not being treated properly? Because despite all good intentions, like things go wrong. And how have you seen that navigated well?
Here you go.
Sorry, there's a bit of a technical difficulty. Yeah, I think that's a great question. I think if you feel that the provider that you're with is not, treating you with care, they're not, answering your questions, or they're putting off your concerns, I think the best thing to do is to request another provider, right? I usually work with a team of 2 to 3 residents and an attending, and so you don't have to work with somebody that is not treating you with respect. There's also ways to report these scenarios too. In our hospital, we have guest services to kind of document things. Depending on your nursing staff, love my nursing staff. They do a great job too, so that they can also intervene as well. So I think those are some of the things that I would suggest.
You can write a letter. Yes. I'm gonna write a letter. Yeah. But no, thank you. And I don't think we always think about the fact that we can actually, try to have our voices heard in another way after the ER visit. Usually we're just so happy to be out of there, but we don't think about Chasity, like, no, we getting you out. Like, I'm gonna let you know. But up next, we have another segment, tips for your best doctor visit. And the law says that a doctor is only required to see you here in the US 30 minutes on your first visit and 15 minutes on your second visit. So Dr. Ade, COO Hart, and Dr. Michaela, a patient's first visit is 30 minutes. Name 3 things a patient should accomplish on that visit and why. Go. Either Dr. Ade, Dr. Michaela, Felicia, if you want to jump in.
Sure, I start. I can start. So 3 things. A 30-minute visit, I am a person, I'm writing down my questions ahead of time. You want to know what you want to ask, because once you get in, you're for sure going to forget. The doctor has their approach, and you have your things you want to accomplish. So write down your questions. Medications. It's important that you know what medications you're taking. And if you don't know the name of them, just bring them. Drop them in your purse, whatever. Bring your bottles with you so that you can be able to properly inform your provider about what medications you're taking. And then know the reason for your visit. This is your first visit for what? Why are you there? Are you there to establish care with this provider? Do you need refill on medication? Did you have lab work? Do you need to go over your lab work? Don't go in and have the provider tell you why you're there for the visit. Know the reason for the visit.
I love it. I can't tell you how many times I see people for first visit and they don't know why they're there. So I think it's really a big, important part of prepping. It's true.
And I would say for the emergency department, unfortunately, we don't have that much time with patients. So having that number 1 chief complaint, we're not going to be able to address all of your needs, unfortunately, in the visit. So having like the first or second reason why you're there, being able to communicate that effectively, I think really makes the visit efficient and fruitful for everyone involved.
And we talk about a 15-minute appointment. Is there anything else that we need to consider? What's one thing to accomplish from a 15-minute visit?
I think you should just have an expectation to know you got 15 minutes, right? So don't go in thinking you're going to get 30. That's the first thing. So make it shorter and just have that expectation. Okay, what is it that I need to talk to the doctor about today? You can't go in and have a storybook and then be like, oh, we have patients that do the front end like, I forgot to tell the doctor that my leg's been bothering me all week. Well, you get in there at 30 minutes, right? You have to make sure that you prioritize the chief complaint and you know what it is that you want to say out the gate when you're going into a shorter window or a short visit. Get to that first.
I love it. And I think that finding a way to tie things up at the end, like what is the next step? What's the plan? Because I think sometimes we get so busy sharing what we want to say that we don't really have a plan for what happens next.
Absolutely.
So have your notes ready, and then make sure you have a plan of action. Now we're gonna go to our lupus warriors. What is one thing you make sure you do in either or each of these scenarios? Let's start with Chasity.
Okay. One thing I do is say what has and has not been working. So like when I go in, I know if I've been having like symptoms, or if I'm in a flare segment, I'll be keeping track of, okay, this started happening on this day. This has been happening. This is like, I track my symptoms so that by the time I get there, I've been keeping up, and I can have my back was hurting this day, then my ankle swelled this day, and then it didn't swell this long. And when I'm waking up in the morning, I'm stiffening. Like I keep track of what has been going on with me, so that they can follow, okay, maybe we need to switch her medication. Oh, so I have that listed.
Jameisha, close us out.
I think everything that everyone else has said, and I think I'd also say I have my descriptors for the types of pain ready as well, so to kind of detail it. And I also describe the things I cannot do anymore, like what the pain is impeding me from doing. I think that helps me explain it better. So if I say like, oh, I have a seated job where I'm editing at the computer, this pain is so bad I can't even sit at the computer, and it's been happening for this period of time, I think it helps kind of build the picture better.
Ooh, I love that description, being very descriptive. Well, listen, I wish we had like another hour to talk. Everybody here is so brilliant and so experienced and has so much knowledge to give. And so I do hope everybody makes sure they check out all of these social medias that's listed on the screen, and check out our different folk. Let me see. We have a nice show, and we appreciate you, Chasity, Felicia, Jameisha, Dr. Ade. Thank you for being here tonight. And make sure you check out all the amazing things our guests are doing. Check out Dr. Ade's award-winning documentary, Black Motherhood Through the Lens. It's going to be premiering next April. We have Chastity's album, Stages, is out now. And you can also check out the films that are coming out that are film festival recommended picks and things like that. And wishing her more success with that. And make sure you check out Jameisha's platform, You Look Okay to Me. Yes. Please make sure you check that out. And passing it over to you, Dr. Michaela.
Wow, this was a whirlwind of a night. We talked about so much, but we really talked about health equity, and it's just such an important conversation to me, because I think this is how we talk about how people of color and women and everyone gets equal access to care, and also just gets answers from the healthcare system. So, one thing we've talked about before is, how we can get answers in lupus. And, I do want to talk a little bit about how research plays a role in that. And, from looking at different medications and monitoring all different people is how we're going to really get equity in understanding how medications and treatments work. So if this is of interest to you, if you want to learn more about that, please check out www.biogentriallink.com. That's biogentriallink.com. You'll see that below. And please join us for our next episode, because we are going to be talking about just that, clinical trials. And that is going to be happening Tuesday, September 26th, same time, 6 p.m. Eastern Standard Time. We will be live. And I have to hand it over to Chanel so we can hear some of her beautiful poetry.
What is equity, if not sharing the mind and heart of a space with others? Value in various tongues, exalting cultural wisdom. What is justice, if not addressing the harm that railroads its way through generations? The why has been there for years. Today, we investigate the how. So many people ask when, and the movement says right now, this is the time. Focusing on the future, reflecting on the past, destroying and rebuilding a world where justice and true equality, true equity, truly lasts. Thank you, y'all. See you all in a few weeks. Much love.